Having cataracts can result in increasingly poor vision. These patients aren't able to benefit from laser vision correction. But there is an alternative for them called the bioptic procedure. Dr. Arthur Benjamin of the Benjamin Eye Institute in West Hollywood explains the new procedure.
A bioptic procedure is a surgical procedure to correct refractive error, and it's actually two procedures done in one. The bioptic procedure combines in itself a lens exchange procedure, which entails removal of the natural cloudy or non-cloudy lens and replacement of that lens with an intraocular lens implant. And the second portion of the procedure is the refractive procedure to remove the astigmatism or any other refractive error. So LASIK combined with lens exchange is the definition of bioptic. The kind of patient that would benefit from this kind of procedure, or for whom this procedure is indicated, is a patient who is a poor candidate for laser vision correction, either because they have a cataract or because their cornea is too thin to have the lamellar refractive procedure, or because they have astigmatism that's too high, or actually now with the advent of the multifocal lenses that correct not just nearsightedness but presbyopia, anyone over 40. Renee's case is very interesting. She had severe allergies to contact lenses, and because of her very high astigmatism, she could never get adapted to glasses, so she was really handicapped with her vision. She was never a good candidate for LASIK because her astigmatism was too high, her nearsightedness was too high, and eventually when she developed a cataract in her eyes, she became a candidate for the presbyopic lens exchange. Renee had laser vision correction performed to remove the astigmatism, and immediately after that, a week or two after that, had a lens exchange to correct nearsightedness and presbyopia with a multifocal lens.
My eyesight now is really so vastly improved that it's almost a miracle. It really is. So I'm really happy with my eyesight now.
Alan is a very special patient. He came in to me for the treatment of a cataract and presbyopia. In the left eye, Alan had a Restore lens put in. This is a special lens implant that allows patients to see distance and near. And I implanted the so-called Resume lens. This lens is more distance intermediate dominant, and that allowed Alan to achieve incredible depth of focus, whereby he could see immediately after surgery. He was given a reading card. He could see the card from very close to his face and could move it out to the length of his eye, and at the same time the card continued to be in focus.
I see great. I had two different eyes done, and so the second one, the right eye, is still healing. So later in the day, it's not as good as it is in the morning, but it's getting better and better every single day. And I see 20/20 distance, 20/20 up close.
The surgery is performed under topical anesthesia. This is the patient getting their pupil dilated from the drops. This is how the patient sees with the cataract or with an uncorrected eye. This is how they see once the surgery has been performed. Microscopic incision is performed with a diamond blade. This incision is in the order of 2.5 millimeters. Through the small opening, a capsule is opened up, and the lens, which is residing within that capsule, is vacuumed out. The lens implant is then inserted. It's a foldable lens implant, is inserted in the eye and unfolds gracefully within the eye. With the advent of the multifocal intraocular lens implants, Resume, Restore, even Crystal lens, this has finally become a reality where we can actually give patients both distance and near vision without compromises. This is a very exciting time in ophthalmology.
You're watching the award-winning American Health Journal.